I'm actually doing a study on this right now to ask people living with DID, how have they been impacted by these media portrayals? And the stories, the quotes that we're getting back are just so painful. Like, they hated themselves. They didn't want even their clinicians, their mental health professionals to know about the disorder. And in some cases, even the professionals were scared of them because of these stereotypes. They're very damaging. They're often very embarrassed about their mood. Their mood changes, but even more importantly, the lapses they have in memory. Imagine you or I, we don't know somebody who greets us on the street, who obviously knows us, calls us by name, and is referring to a conversation or an interaction we've had. It would be mortifying. They have that happen a lot. And so it's embarrassing, and they try and cover that up like anybody else. Anytime anybody else covers up something we've done that feels embarrassing.
As you mentioned, there are tests, there are ways that you determine whether people actually have this disorder. How do you assess patients for dissociative disorders, and then what kinds of treatments are available?
Sad to say, but most mental health professionals have not been trained in assessing dissociative disorders. They don't even know that much about dissociation. At the start of the hour, you talked about how there's some controversy about dissociation and dissociative disorders. And so that's one of the factors that leads to many graduate programs, medical schools not doing training about it. So first of all, a person would need to go to somebody who's had training in assessing dissociation. And I'm currently actually writing a book for the American Psychological Association on assessing dissociation. It is the first book that's ever been written solely about the multiple ways you assess for it. So that shows you how far behind our field is in really learning about assessing dissociation.
The ICD-10 and the DSM-5 do not provide clear diagnosing guidelines for DID, making it difficult to distinguish genuine DID from imitated or false positive cases. This study explores meaning which patients with false positive or imitated DID attributed to their diagnosis. Authors who wrote about patients inappropriately diagnosed with this disorder use terms such as malingering or factitious DID. Coons and Milstein, 1994, Thomas, 2001, according to Dreiser and Boone, 1999, both labels imply that patients intentionally simulate symptoms, either for external gains, financial benefits, or justification for one's actions in court, or for other forms of gratification. Now, as we go on, you're going to find out that these psychologists actually have really good assessments to decide if you have DID or not. And I am so proud and so happy to be even a part of these studies. The little bit that I do know, I don't know much because, like I said, there are boundaries that I'm not allowed to cross, and my therapist is very good about that. But I was informed that some of my work is being used to help others, and that's important. And, some on TikTok are claiming that because of my knowledge, because of the research I do, because of pointing out lies or false information, that I make an income doing so. And I'm going to point out again that that is the biggest load of bull that you can possibly spread. Honestly, I get to the point where it's like, show me where I'm gaining financial gain in any. I'm disabled. I'm actually in the works of trying to go back to school, and I will show you what that's about. So because I don't want to give too much of my private information out, I have an envelope here, and it's from a university where I live in my state, and it's through DVR. And what DVR is it's called a Vocational Rehabilitation Institute. And what they do is they work with people with disabilities so they can work a little bit or start college. And my goal is to go to college and do it from home, because I have severe agoraphobia. They're willing to work with me. And that's the thing about people that are being honest, they're willing to work with you. And I have a bunch of paperwork here I have to fill out. They're asking basically for my medical records and my mental health records from multiple places. So these are things that you have to fill out. And these are things that people that imitate DID don't talk about. I've put too much work and too much time and effort to even deal with people that are acting like this. So let's get back to the video with Dr. Brand.
And in the movies, DID is often shown as a dramatic and a sudden switch between personalities. Is that what it looks like in real life to an observer?
I'm so glad you're asking me that, because that occurs in less than 5% of cases. So, of course, the media has to show these dramatic shifts that, somebody comes in talking in baby talk, and then the next time they come in swaggering and a cigarette draped out of their mouth. So that's so the audience can figure it out. If DID really looked like that, it wouldn't be so underdiagnosed and misdiagnosed. It's often misdiagnosed as schizophrenia because more than 75% of people who have DID hear voices, or it's misdiagnosed, for example, as bipolar disorder because there's these mood shifts. They look like moody people. Now, neither of those disorders have amnesia associated, and they're not trauma disorders. So DID is not at all schizophrenia. It's not at all bipolar disorder. And those media portrayals obviously contribute to some of the reason why there's so much underdiagnosis of DID.
To avoid misdiagnosis, clinicians should receive more systematic training in the assessment of dissociative disorders, enabling them to better understand subtle differences in the quality of symptoms and how dissociative and non-dissociative patients report them. This would lead to a better understanding of how patients with and without a dissociative disorder report core dissociative symptoms. Another thing I want to bring up again for the umpteenth time, and the reason I bring it up is because it is vital that, these things be taken care of. Again, I repeat, talk to your therapist and mention the misinformation and the depiction of DID being displayed on TikTok. The number is growing where clinicians are aware, the APA is aware, and the videos are somewhat being taken down. And the reason I bring that up is because if you don't report the videos to TikTok, they are not going to do anything about it. They're too busy dealing with millions and billions of people. So when you see something that is misrepresenting DID, or your therapist or psychologist see something misrepresenting DID, I ask that you do not attack these people. It is not worth it. They will literally talk about you, make up false lies about you, and you're already dealing with a mental health disorder that is based on a very severe trauma of your past. So it's best to just go in quietly, report the video, do not respond. Sometimes they will like to say things or blame you for attacking them or bullying. Now keep in mind, you are not bullying or attacking. You are quietly reporting to TikTok. And if they meet the rules that they broke, then they're taken down. That's not on you. That's not you attacking them, bullying them, stalking them. It is you reporting a public video to be taken down. And if TikTok feels that that violation was made, then that person should be taking it up with TikTok, not bullying you. If they're bullying you, it shows their true colors and the malingering side of their DID that they claim to have. So I also want to point that out. I hope that you found that useful.
There are a number of scientifically validated self-report questionnaires that a clinician could use. There are also standardized evidence-based interviews, structured clinical interviews for dissociative disorders, and hopefully a clinician would use one or more of those tools to make an accurate diagnosis. It can also be done without those tools, but then there's more errors. There's just more errors. Like when doctors do blood tests, that you've got a greater chance of getting an accurate diagnosis. And the same thing with mental health conditions, especially this one, because it really can sound like and seem like different disorders.
I understand that there are some people who have other mental conditions who may pretend to have dissociative identity disorder. And certainly there's the infamous story that became the book Sybil and was later a movie starring Sally Field that some of our listeners may have seen. How can a clinician tell if someone is faking it?
So one of my lines of research has been on establishing data across various tests, psychological tests. Some are what are called malingering tests, and they're supposed to pick up on the possibility of malingering. And I have, with students in my lab, we have developed data that shows this is what genuine patients with DID score on these various tests, and here's what people who are imitating, faking DID score, and this is how you distinguish them. So there is evidence that helps, a whole body of evidence across, I forget, 6 or 7 or 8 tests nowadays, where we've shown ways to distinguish the two. And also, if clinicians use those evidence-based measures I was talking about earlier, that helps them have some idea of how does this person's report of symptoms compare to other people who have dissociative disorders. So it goes back again to know the science, follow the science, and use the science.
So, there's been a lot of advancement in the study of psychological disorders through brain imaging. And I'm wondering, has much brain imaging been done with people who have DID, and do their brains look markedly different?
Yes, there are 3 labs that are working on that in particular. There's, I'm sure, other labs as well. But there's a Harvard lab working on this. Ruth Lanius up in Ontario is working on it, and a woman in the Netherlands and her team. And there's a couple of other people in the Netherlands. And summarizing very briefly, they are seeing that there are brain network patterns that distinguish people who are highly dissociative from those who have what I'm going to refer to as classic or simple PTSD, post-traumatic stress disorder. So there's now, in the more recent diagnostic manual, there's dissociative PTSD and regular PTSD. And the dissociative folks, as it might sound like, they tend to, when they go in the brain scanner, for example, and hear their trauma stories read to them while they're in the brain scanner. So they're essentially having a flashback, and they're warned about this up front. They're very brave, and they do the studies, which helps us tremendously understand, traumatic brains. And what we see in the scanners is that some areas of the brain start shutting down, going offline, if you will. There's less connectivity there. There's less brain flow, those sorts of things. And there are different patterns of neural activation, different network patterns, different blood use patterns that distinguish these 2 types of trauma reactions. So one is an emotional, aroused, as I was referring to earlier, sort of a jacked up, hyper aroused, flooded state, and then the shut down state.
Already in 1995, Boone and Drazier stressed that a growing number of people self-diagnose themselves based on information from literature and the internet. During psychiatric or psychological assessment, their observation of 36 patients in whom DID had been ruled out after applying the structural clinical interview, the SCID-D. These clinicians identified differences between genuine and imitative DID. They classified their participants into 3 groups. 1, borderline personality disorder. 2, histrionic personality disorder. 3, persons with severe dissociative symptoms, but not DID. Participants in that study reported symptoms similar to DID patients, including amnesia, but only for unacceptable behavior. Depersonalization, derealization, confusion, and identity alteration.
There have been some news stories lately about how some viral TikTok videos about DID have led to an uptick in people diagnosing themselves with the disorder. How should mental health providers respond to that?
I have heard about this, and I've been consulted on a number of these cases, and it's true. It's an issue we have to be really thoughtful about, because some people are accurately self-diagnosing And then there's others that may not be accurate. And so I go again back to science and these validated measures. I urge any clinicians out there to learn about these measures and use them and help clients understand whatever their presenting complaints are. Some of the cases I've heard about related to TikTok are individuals who really don't have a cohesive sense of themselves. They don't understand themselves. And they do relate to some of what they've seen, whether it's DID or not. There's some aspects of who they are that sound similar.
So how do patients describe the experience to you? Are they aware that they're shifting from one alter to another?
They vary tremendously when they come in for treatment. Typically, when a person who actually has DID comes in for treatment, they tend to come in with reports of severe crushing depression that hasn't responded to any medications or previous trials of psychotherapy. They often have post-traumatic stress disorder. They tend to be aware of that. They may have a substance abuse problem. They may have an eating disorder. They have problems with sleep. Every so often, there are people who come in and they're aware, or they think they are aware of having dissociative states, but that's actually not so common. Although with all the social media that's out there now, more people are sometimes coming in, at least in my experience. I've been in the field for about 30 years. And I do have some people who have come in and said, I think I have this. And I proceed to do, a standardized assessment and find out if it's accurate or not.
And where can people go if they think they might have a dissociative disorder, whether it's DID or something related? Is there someplace special, some particular kind of practitioner they should look for?
Yes. So as I was saying earlier, try to locate somebody who's had training in trauma-related disorders, including dissociation. There's a professional organization, I'll say the name slowly. It's the International Society for the Study of Trauma and Dissociation. It's abbreviated ISSTD. And if you just search for that online, they have a website. They have all sorts of information, frequently asked questions. They have some questionnaires, resources that clinicians can access.